A breast cancer diagnosis can bring urgent questions. What happens next? Which treatment will I need? And how will treatment affect everyday life? This video is a plain language overview of commonly used treatments and possible side effects. Every cancer and every person is different. Your oncology team, who knows your diagnosis, other health conditions, and goals, should guide decisions and symptom care. This video is education, not personal medical advice. Breast cancer begins when cells in breast tissue grow out of control. It can occur in women, men, and people of any gender, although it is much more common in women. A new breast or underarm lump, skin dimpling or swelling, nipple changes or bloody discharge, or a change in breast size or shape deserves prompt medical attention. These changes often have causes other than cancer, but it is important to get checked. After a biopsy confirms cancer, the care team considers its stage, how large it is and whether it has spread, as well as its grade and biology. Pathology tests look for hormone receptors, called estrogen and progesterone receptors, and for HER2. Some cancers are hormone receptor positive, some are HER2 positive, some are triple negative. Genetic or genomic tests may also be useful in selected situations. These details help determine which treatments are likely to help. A multidisciplinary team may include a breast surgeon, medical oncologist, radiation oncologist, nurses, pharmacists, plastic surgeon, social worker, navigator, rehabilitation specialist, and others. Ask what the goal of each treatment is. In early stage disease, treatment often aims to remove or destroy cancer and reduce the chance of it returning. In metastatic or stage 4 disease, treatment can often control cancer, prolong life, and protect quality of life. Palliative care is specialized relief of symptoms and stress. It can be added at any stage and does not mean giving up treatment. Surgery is a local treatment, meaning it treats the breast and nearby lymph nodes. Breast-conserving surgery, often called lumpectomy, removes the cancer with a rim of healthy tissue. It is commonly followed by radiation. Mastectomy removes breast tissue. Reconstruction may be done at the same operation. A lymphedema therapist or physical therapist can help. Your surgical team will give specific wound care instructions and tell you which signs, such as fever, worsening redness, drainage, or sudden swelling, need an urgent call. Radiation uses carefully planned high-energy beams to treat a specific area, often after lumpectomy and sometimes after mastectomy or for symptoms from cancer elsewhere. It is delivered in small daily doses over a schedule designed by the radiation team. It is not painful while it is being delivered, and you are not radioactive after standard external beam treatment. During or shortly after treatment, the treated skin may become red, dry, itchy, tender, or darker, much like a sunburn. Fatigue is also common. Skin reactions often build gradually, then improve in the weeks after radiation ends. Use only skin products approved by the radiation team, protect the area from sun and friction, and report blistering, peeling, or severe pain. Less commonly, radiation can contribute to lasting skin or breast changes, shoulder stiffness, swelling, or effects on nearby organs. Modern planning works to limit these risks, and your radiation oncologist can explain the benefits and trade-offs for you. Systemic treatments travel through the bloodstream. Chemotherapy attacks rapidly dividing cells. It may be given before surgery to shrink a tumor, after surgery to lower recurrence risk, or for cancer that has spread. Not everyone needs chemotherapy. Its side effects depend on the medicines and dose, but can include fatigue, nausea or vomiting, appetite or taste changes, mouth sores, hair loss, diarrhea or constipation, numbness or tingling in hands and feet, and low blood counts. Low white blood cells can raise infection risk, low red blood cells can cause anemia and fatigue, low platelets can increase bruising or bleeding. Treatments and dose adjustments can often help. Tell the team early rather than trying to push through. Endocrine, also called hormone therapy, is different from menopausal hormone replacement. It blocks estrogen's effect or lowers estrogen levels, and is used for hormone receptor-positive cancers, often for years. Examples include tamoxifen and aromatase inhibitors. Common concerns include hot flashes, vaginal dryness, changes in mood or sleep, fatigue, and joint or muscle aches. Aromatase inhibitors can weaken bones over time, so bone health may be monitored. Tamoxifen has different uncommon but serious risks, including blood clots and uterine changes. Do not stop a medicine on your own. Your team may have strategies or an alternative. Targeted therapies act on particular features of cancer cells. For example, HER2-targeted medicines are used for HER2-positive cancer. Other targeted drugs may be chosen based on cancer features or gene changes. Side effects vary widely by drug. Possible issues include fatigue, diarrhea, rash, changes in blood counts, liver effects, or heart function effects with some HER2 therapies. Monitoring tests are part of safe treatment. Immunotherapy helps the immune system recognize or attack cancer and may be an option for selected cancers, including some triple-negative breast cancers. It can cause fatigue, rash, diarrhea, or flu-like symptoms. Because it activates immune activity, it can also cause inflammation in organs, such as the lungs, liver, intestines, thyroid, or other hormone glands. New cough or shortness of breath, severe diarrhea, yellowing of skin or eyes, severe rash, or unusual weakness should be reported immediately. The right medicines depend on tumor testing, disease stage, prior treatment, and your overall health. Side effect care is cancer care. Keep a simple record of symptoms: when they began, how severe they are, what makes them better or worse, your temperature if you feel unwell, and all medicines or supplements you use. Bring it to visits or use your clinic's patient portal. Ask before taking vitamins, herbs, or over-the-counter remedies, because some can interact with treatment. Your team may prescribe anti-nausea medicines, treatments for diarrhea or constipation, pain medicines, mouth care, skin care, or medicines to support blood counts. Small, frequent meals, fluids, gentle activity is tolerated, rest, and accepting practical help can make treatment more manageable. An oncology dietitian, social worker, counselor, sexual health clinician, fertility specialist, or support group can offer valuable support. Before treatment begins, ask about fertility preservation if future pregnancy is important to you. Call your oncology team promptly for a fever at the threshold they give you, often 100.4 degrees Fahrenheit or 38 degrees Celsius during chemotherapy. Chills, signs of infection, uncontrolled vomiting or diarrhea, inability to keep fluids down, unusual bleeding or bruising, new confusion, or pain that is not controlled. Seek emergency help for chest pain, severe trouble breathing, fainting, sudden weakness, or signs of a severe allergic reaction. Use your own clinic's instructions when they differ. Follow-up care continues after active treatment. It may include exams, recommended imaging, rehabilitation, management of long-term effects, and discussions about emotional health and recurrence concerns. Many people find that recovery is not a straight line. Needing help is normal. Bring questions to every appointment. What is the goal of this treatment? What benefits can I reasonably expect? Which side effects are common and which are urgent? Who do I call after hours? And what support services are available? You are an essential member of your care team. Clear information, early symptom reporting, and support can make the path through treatment safer and more manageable. For trusted patient information, visit the National Cancer Institute at cancer.gov, the American Cancer Society at cancer.org, or the CDC at cdc.gov/cancer. For personal advice, contact your oncology team. You do not have to navigate this alone.